Are AVMs hereditary?
So we've been talking today about high flow AVMs, AVMs that consist of a high volume of blood under high pressure. And these types of AVMs are typically considered solitary vascular malformations, meaning that they are not genetic and therefore not hereditary. There are some high flow AVMs that are part of a genetic syndrome called HHT, which is a genetic syndrome that leads to multiple, typically small high flow AVMs that can occur in patient families. It's a genetic disorder. And in those patients with a family history of HHT, it's important and imperative to test other family members for that gene to see if they are carriers of that gene, because if they are, that would impact the frequency of screening these patients with MRI scans.
Should I be worried about having multiple MRI scans for my AVM?
So this question comes up from time to time for two reasons. The first is that MRI scans, in some patients perceive MRI scans as being radiation, and they're not. And the other situation in which this comes up is the patients worry about the contrast dye that's being injected into their veins to take the each MRI scan. They want to know what the contrast dye is doing. So we know that AVMs light up with the contrast dye, and the contrast is it's an element on the periodic table called gadolinium. It's one of those metal elements like copper and zinc, and it is used to light up the AVM. After you have the MRI scan, the contrast is typically excreted and flushed from the body by the kidneys, and that's why it's recommended to drink a lot of fluid after these MRI scans. In some patients in which they have poor kidney function or missing a kidney, we oftentimes skip the contrast because it's not worth the risk to the patient in that sense. However, most patients with good, healthy functioning kidneys, the contrast dye is typically not an issue. Good MRI scans can show the AVM on non-contrast sequences, though it is possible to miss small AVMs on non-contrast MRI scans. So my thought process for this question is that if we have several MRI scans that show an AVM with the contrast dye, but we can also see the same AVM on the non-contrast sequences, that means that subsequent future MRI scans could potentially be non-contrast as long as they're good quality scans and we can still see and measure the AVM. CT scans or CAT scans are radiation. MRIs are not radiation. So they're not in the same kind of general category, and a patient should not be worried about radiation exposure with MRI scans.
If you like this video, don't forget to subscribe.